and you're done, say, with all your manual therapy, you're starting your neuromuscular re-ed and or your strengthening component. And now we have options on how to turn this support into kinesio support, which they can actually strength train with and do any neuromuscular stuff that you're doing in the clinic. Okay, so this is much more, it's much easier to use and bend and not worry about, is it coming off, is it restricting them? Because this would not be for neuro re-ed, right? This, you're not going to get any input into the tendon. If you need to load the tendon needs to be free to be loaded, okay? So we've got a piece, I don't know, maybe, 6 inches long or so. I've broken it to the ends because that's where I want my hands to grip. I take out the middle, okay? So now I'm not touching the adhesive. So what we're going to do is we're going to put their knee into some flexion. We can see her patella, so I know her patella tendon's right here. I'm going to put about 50% stretch into my tape so that I can see the wave patterns. I'm going to push right up and into the patella as I wrap around, almost hugging the patella, okay, right, supporting it all the way around. And then I would backtrack my little piece here and lay this down without any edges or without any tension, okay? So the bulk of what I did was right here, you lay this down so we don't get any popping off when they go to bend or flex. And then you would activate your glue by rubbing vigorously on the tape. Now I would encourage you guys to use a light spray when you're using Kinesio tape, because again, things will pop off, fall off. Clean that skin, soap and water, really dry it, and then use a light spray as long as they're not allergic to the spray, or use the skin prep under to try to get a good adherence instead to the skin prep. Because again, the knee area takes so much action with bending and flexing through everyday life that we need to make sure that's going to stay on for the full 3 to 5 days and not just get home tonight and they climb their stairs and it pops off. Okay, so there is our kind of like version of this, but in a very stepped down approach, but that can still give some input to the patellar tendon. Okay,